Welcome, dear viewers, today to our format on natural medicine. Again and again, people suffer from indefinable muscle pain or chronic headaches, and it is always difficult to find a real solution. Often there is also an odyssey of many doctor visits behind the patient. Today we will listen to a patient who has exactly this path behind her, and how she came to a solution and rediscovered a new way of life for herself. And of course also her practicing doctor with us in the program, Dr. Harald Burgard. Stay tuned. Hello, dear Harald.
Hello.
Hello, Mrs. Wagner-Weier. Nice that you took the time.
Hello, glad to be here.
Yes, this whole picture of suffering with chronic headaches and muscle pain I hear again and again from people who are looking for solutions. And I am very happy that you have the time and the courage today and are also so open to talk about your story. And I'm really looking forward to hearing from you.
Yes, it all started for me 7 years ago, when I had my dentist amalgam removed. In full confidence that he would do the right thing. Unfortunately, this was not done with today's precautionary measures, so that I got sick afterwards. I got these muscle and joint pains. I've seen a number of orthopedists. I was at the rheumatologist. I was at the neurologist. And no one could help me, no therapy helped me. I didn't want to do some therapies, because they were just too invasive. And then I was finally transferred to a dentist who does biological dental medicine. And then he saw that I was still completely poisoned with amalgam. Removed everything, did everything anew. Because the first job was not done properly. It was very, very frightening, what had not been done well. And then I found my way to Dr. Burgard in Wadgassen, who offered me various therapies. And the ones I noticed right away, that helps. Among other things, chelat therapy, blood laser. And finally I came to apheresis. And now I've been in treatment for a year. I am now almost completely pain-free and have a normal life again, which was not there before.
May I ask you, when you did the amalgam removal, did the headaches and muscle aches occur immediately? Or was it this mandatory half a year later, where many no longer found this connection?
Exactly. It was after half a year when I also got into a big stress situation. And then the complaints were suddenly so intense and inexplicable. And of course every doctor said, yes, you've already done your teeth, so that no one saw any connection there anymore.
So it is really always frightening how carelessly these amalgam topics are handled. And from the point of view of regeneration, what were your progresses? Did you start with a chelat infusion for the first time? Or how did it go?
First of all, everything was actually started at the same time. Because I had a lot of pre-reports, Dr. Burgard immediately did several therapies. There was no need to look for the causes anymore. He immediately saw that the heavy metal load was infinitely high, so that I did the apheresis 6 times last year, always 2 in a row.
die Apherese gemacht habe, letztes Jahr gleich 6-mal, immer 2 hintereinander.
And in addition,
Und
the chelat
zusätzlich,
infusions, as the time
die
allowed, because it is also very time consuming.
so wie es zeitlich halt ging, weil es ist ja auch ein großer Zeitaufwand.
Mhm.
Ja.
May I ask you
Darf ich kurz
briefly,
fragen,
Harold,
warum
why did you
hast du jetzt
combine the
die
apheresis with
Apherese mit
chelat?
Chelat nochmal kombiniert?
What can the
was kann
chelat
die
therapy do here?
Chelattherapie da?
So if patients have a very high metal load and metals release the pain in the muscle tissue, are mainly lead, cadmium and tin, then it is always about lowering the metal load as quickly and effectively as possible.
Belastungen im dreistelligen Bereich, dann geht es immer darum, dass man möglichst schnell und effektiv die Metallbelastung senkt.
And the chelat therapy is the therapy that can be done quickly in a short time, which is simply cheaper and shows very good effects.
Und die sehr gute Effekte zeigt.
And that's why we use the chelat therapy. Because pathogens also play a role in it. There are also pathogens that release muscle pain and things like that. We have also proven that. For this we also used the blood laser. I have also written things down for at home. And the toxopheresis, i.e. the apheresis to excrete environmental pollutants, we did that because on top of the toxic metal load.
Die haben wir deswegen gemacht, weil es in aller Regel über die toxische Metallbelastung hinaus.
There are toxins from various areas, which we have also evaluated, which solve the problem in the sum.
Die in der Summe bei dir das Problem auslösen.
If you have lead and cadmium, there may be 1 and 1 equals 2.
Dann mag vielleicht 1 und 1 noch 2 sein.
But if formaldehyde is added, pesticide, insecticide and 3 to 4 pathogens, then 1 and 1 and 1 is not 3, but 10, 15, 20. We just can't see what in which potentiation which problem resolves. And that's why you go in her case to try to treat as little as possible, but as intensively as necessary. And we did that. And so that it goes faster in between, the chelat therapies were useful with the high load to lower it faster. That's cheaper, that's also time-saving. The apheresis I can't do every week.
Did you find out why this lead content was so high? And this tin? It has nothing to do with the amalgam story, right? I come from an agricultural company where pesticides were used.
Wo halt mit Pestiziden gearbeitet wurde
And all the machines.
die ganzen Maschinen und ja,
And as a child you are
ist
always
man
close to
immer
it.
nah dran.
And at that time there were no precautions. You didn't think that this could poison you.
Einen vergiften könnte.
It is also the case that now, for example, in her case it is not about that she is still absorbing it now, but it is in the body. So these are old loads. And that can come from childhood. Tractors, all combustion engines had lead as an additive in gasoline before 1994. As an anticonvulsant. And of course it is blown out and we store it. And if you have lead in your body, the body disassembles it. But it takes about 50 years to dismantle half of it. That means the stuff stays in there for a long time. And then it reacts. And then other things come along that the body still has to dismantle. And if that becomes too much, then maybe a stressor comes along and everything explodes. These are old loads.
In terms of quality of life in the phase when the poisoning was acute, how was everyday life to be described? Or was that?
It was a completely different life. I was always tired, always weak. I had to sleep during the day. The energy was no longer there. I could only do the minimum what you need to live. It was really very, very bitter. Inexplicable. And then you come to the point that the neurologist prescribes an antidepressant. And then I did that for a few months and thought, no, that's not life. It doesn't treat the causes, it only treats the symptoms. And then I said, I won't take it anymore, even though he wanted it that way. Then I put it off. And I went back to the search for the causes. I was only
all
looking
die
for the
Jahre
causes
nur auf
all
der
those years.
Suche nach den Ursachen. Ja,
Unbelievable.
Unglaublich.
And
ja.
the first
Und die
apheresis, how did you feel
erste
afterwards?
Apherese, wie ging es Ihnen dann danach? Waren dann
What was
ja
the
einfach, was
effect
war
of the
der
first
Effekt von
session?
der ersten Sitzung?
A huge effect was not there because the load was so high,
Da, weil halt die Belastung so hoch war.
but I
Aber
was
ich war
insanely tired after the first two
wahnsinnig
apheresis,
nach den ersten beiden Apheresen und
and I
habe
needed time to
auch
rest.
Zeit gebraucht, um mich zu erholen.
Mhm.
Ja,
In sleep
Ja,
or
im
in rest,
Schlaf oder
the body
in
regenerates
Ausruhen
well.
regeneriert der Körper ja auch gut.
Ja,
Ich
I
meine, der hat
mean,
ja
it
wahrscheinlich
probably has a
einiges
lot to regenerate.
zu regenerieren.
ja,
Yes, that's the way it
Ja.
is.
ja.
Many also
Viele
describe that
beschreiben
after
auch,
the
dass sie
apheresis
nach
they
der
feel
Apherese
younger,
sich
fitter
irgendwie
again.
jünger fühlen, wieder fitter.
Were there
Gab es da
any
irgendwelche
effects among us
Effekte,
women?
so unter uns Frauen?
Yes,
Ja,
the
also
last
jetzt die
apheresis,
letzten
that's refreshing.
Apheresen, ja, das ist schon auffrischend. Ja,
Yes,
doch,
you
das
can
kann man
definitely say
sagen, auf
that.
jeden Fall.
It
Es
really
reinigt ja
cleanses.
wirklich,
The
das
entire
ganze
connective tissue
Bindegewebe
is
wird ja
cleaned.
dann auch gereinigt sozusagen.
Can you
Ja.
really see
Also
it
sieht
in the
man es dann auch
connective
wirklich im
tissue?
Bindegewebe, so bei
In the case of
jetzt sag ich mal
cellulite and such things?
Zellulite und solche Geschichten?
I
Ich
would
würde
say
schon
so.
meinen, ja.
Okay,
Okay, jetzt
now this
bekommt diese
technique gets a
Technik
whole
nochmal
new
eine ganz
quality.
neue Qualität.
It is
Ja,
also
man
said
sagt ja
that
auch,
when the
wenn
body is
der
heavily
Körper
metal
Sterbefall
burdened, that
belastet
when we
ist,
go
dass
into the
wenn die
sun,
Sonne
the age
kommt,
spots
einfach
or
die
grey hair simply
Altersflecken
appear.
oder graue Haare, solche Geschichten.
I also find it
Finde ich
super
total
exciting to
super
find out if I can do
spannend
it again,
zu
that my
erfahren,
hair is no
könnte
longer
es
so
vielleicht
grey or
ergeben,
that age
dass
spots go
meine
back
Haare
or
nicht mehr so
wrinkles.
grau sind oder dass Altersflecken zurückgehen oder Falten. Das sind
Of
natürlich,
course, it's
klar
all a
ist das
luxury
alles ein
problem, but
Luxusproblem,
I think it's a nice
aber ich
side
finde es
effect
einen
if
schönen
that were to
Nebeneffekt,
happen.
wenn das passieren würde.
I
Also
would
ich
say
würde
that
schon
something is
sagen,
happening.
dass da sich auch was tut. Falten,
Wrinkles, the
die
age spots.
Altersflecken, es tut sich
Something's
was.
happening.
Ja.
Nice.
Schön.
What are your
Was sind so
experiences when
deine,
people come
wenn,
who are
wenn
so
wirklich Menschen
poisoned?
kommen, die so vergiftet sind? Ähm,
I know it
Ich
from the
kenne es ja
lectures
selber
for
auch
years.
aus den Vorträgen, die ich jahrelang auch
I
ich
always
habe
recognized
immer
right
gleich
away when
erkannt,
people suffered from
wenn
these
Menschen unter
poisons.
diesen Vergiftungen gelitten haben. Und es
It was
war
my first recommendation. Immediately
erste
have a look at
Empfehlung
the
sofort
amalgam,
Amalgam
professional
gucken lassen,
dentists.
professionelle Zahnärzte.
But I'm still
Und ich bin aber
horrified that I
immer
hear such
wieder
stories
trotzdem
where patients are
entsetzt,
sent around for years.
dass ich dann solche Geschichten höre, wo wirklich Patienten jahrelang rumgeschickt werden.
Maybe the
Vielleicht
question to you
nochmal
again,
an dich die
if someone is
Frage, wenn
watching
jetzt
now,
jemand
what are the
zuschaut,
points where it
was
is
sind
really
wirklich
worth
so
looking?
die Punkte, wo es sich echt lohnt, hinzuschauen, ja?
Well, if we stay
Naja,
on the topic of amalgam,
also
it
wenn wir
makes
beim
sense to
Thema
have a
Amalgam
dentist who
bleiben,
eliminates the
ist
subject
es
matter with
natürlich
suction
sinnvoll,
systems,
dass man einen
so that the
Zahnarzt
patient
hat, der das
consumes as little
fachgerecht
as possible during.
beseitigt mit Absauganlagen, Kofferdamm, langsam drehendem Bohrer und so weiter, damit der Patient möglichst wenig aufnimmt dabei.
When
Wenn
mercury is
Quecksilber
drilled out, it
aufgebaut
is
wird, wird er
naturally gas
natürlich in
formed
der
in the
Luft
air at room
gasförmig
temperature.
bei Zimmertemperatur. Und
And I
ich gebe
always
dem
give the
Patienten
patient,
immer,
if they were with me
wenn
before and
sie
go to
bei
the
mir
dentist,
vorher waren und
also
zum
something with
Zahnarzt gehen, auch
DNPS,
etwas mit, damit der
DMSA,
es denen
which
des
people take
Zahnarzt
half
direkt
an
in
hour
einer halben
before
Stunde
and
vorher
right
und direkt
after,
danach
so that
gibt,
what is absorbed
damit
by
das
the
natürlich
mucous
dann aber
membrane
auch
is
in
also
der Zeit
bound
auch
as
noch
well as
wirklich
possible.
gut gebunden wird. Man kann
You
nie
can never reach
100% erreichen, aber
100%, but a
eben
lot.
schon viel.
But what else is
Aber
important is that you look, what
ansonsten
does the
wichtig ist
person
es halt
have,
einfach,
what
dass man schaut,
deficiency
was hat der
symptoms are
Mensch,
there,
ja?
what
Guckt,
toxins are there,
welche
what malfunctions are there, what is with
Mangelerscheinungen
the
sind
intestine,
da,
what is with
welche
inflammation, what
Stoffbelastungen
is with
sind da, welche
metabolic functions,
Fehlfunktionen
are the
sind da, was
hormone
ist mit dem
axons
Darm, was
disturbed,
ist mit
do the
Entzündungen,
adrenals
was
work,
ist
is the
mit
thyroid correct?
Stoffwechselfunktionen, sind die Hormonachsen gestört, machen die Nebennieren mit, arbeitet die Schilddrüse korrekt.
It all
Das
comes
hängt
together very
alles sehr eng
closely and you have
zusammen
to
und man
look
muss
how
halt
it
schauen,
works.
wie funktioniert das, wenn
If
man
you
zum
hear,
Beispiel
for
hört,
example, Mrs.
Frau
Wagner-Weier was very
Wagner-Weier
tired,
war sehr
then that
müde,
explains the toxic
dann
load.
erklärt sich das über die toxische Belastung. Metalle
Metals
wie
like lead,
Blei oder auch
mercury,
Quecksilber,
aluminum,
auch
they simply
Aluminium,
block the
die
cellular
wirken einfach
respiration,
blockierend
so
auf
on the
die
energy-forming
Zellatmung, also auf
structures.
die energiebildenden Strukturen. Wir kennen den Namen
Some people may know the name
vielleicht in den
mitochondria.
Studien. Diese
These
Mitochondrien bilden
mitochondria form
ATP. Das
ATP.
ist
That's
der
the energy
Energieträger,
carrier
den
you
wir
need, and you
brauchen.
have to
Du
form your body
musst
weight from
davon
it
am
per day.
Tag etwa
60
dein
kilos, 70
Körpergewicht
kilos
bilden.
for men, 80
60 Kilo,
kilos.
70 Kilo bei Männern, 80, wenn ein Sportler aktiv
For
ist, der
athletes,
bildet
the
bis zu
buildup
einer
is up
halben
to half
Tonne
a ton,
und du
and
hast
you
einen
have a
Rekord
supply of
von
1.5
Sekunden.
seconds.
Das heißt,
That
wenn
means if
diese
this
Struktur
structure
nicht
doesn't
richtig
work properly,
funktioniert und
and
das
that's
ist oft
often
der
the
Fall, das
case,
können
we
wir
can
messen,
measure
das
that.
war
That
bei
was the
Frau
case with
Wagner-Weier
Mrs.
auch so,
Wagner also. Then
dann
you just
hat
don't have
man
the
einfach
power,
nicht die
then you
Power. Da
notice,
merkt
then
man,
you
man
get
wird
tired.
müde.
Since this is not a disease that happens from now on immediately, you don't notice it at all. It goes so smoothly, then you think, well, you're no longer 30, you're maybe already 50, that's maybe normal, then the doctor or whoever says, look how young you are or how old you are now. But that's not normal. If you detoxify the body and the energy buildup goes up again, then you also notice suddenly that you have more power again. It's not just the pain going back, then the gut gets better, then the idle buildup goes back, the serotonin buildup goes up, then the sleep gets better, then the mood gets better. It all is very closely connected. It's always difficult to explain that en bloc without holding lectures, but you're very connected. You also say that the body, soul, and mind are very closely connected. Many of these processes are simply biochemical. We can control that by now. We can intervene, we can measure very precisely what happens, and we can especially control when it's good again, but this has normalized.
Now I also find an important factor, which I just heard, the gut flora. There are also different approaches. One says, oh, you have to take a capsule, that destroys the gastric acid if you take it liquid. What does your optimal gut buildup look like for the patient?
It looks like that we always do what's the problem with the patient. That means we do a stool analysis and look exactly which pathogens are missing. Is there a leaky gut syndrome? How does the pancreas work? Is there an inflammation? Is there too much, or is there a lack of mucous membrane formation? Depending on that, I give the patient certain probiotics or also nutritional indications, so that the gut flora is not only absorbed orally, but you also nourish yourself in such a way that the things stay on the ground. There are substances, of which we know from science, such as walnuts, linseed oil, macadamia nuts, and so on. Or also resistant strength of group 3, if you eat cooled potatoes, cooled rice, that this is a fix for the gut flora. If you always incorporate that into your diet, then they stay there. But basically, I have to know what the problem is first and then give the right bacteria. If someone has a leaky gut syndrome and I don't give certain bacterial groups, then it's no use. I always have to know what I'm doing and then intervene with the right measures. Whether I take capsules for gastrointestinal resistance or whatever, that's secondary. The gastrointestinal resistance kills a bit of collateral damage exists. But if I take a probiotic that is in liquid form and a few break, then I have to take a sufficient amount. You always consider that as a manufacturer and enough get there.
Dr. Wagner-Weier, was there anything physical? I'm back to this whole detoxification topic. If the body is really poisoned, then you also notice that the lymphs, this whole flow stops, that the upper skin fat tissue simply also changes in structure, or the skin. I'm so glad I'm asking. Alexander never asks these questions. That's why I have to take this part. Also totally unselfish, of course.
So that the skin now has changed a lot. I can't really comment on that. I also got older in the 7 years. And I see it more like that. I got older, so the skin has changed. Yes, it has changed over time. But my concern was always to get rid of this pain and not, how do I look?
Only because the skin is also a detoxification organ. That was the approach.
Yes, the skin is a detoxification organ and it reacts very often, but then when the liver, the kidneys, the intestine don't work properly. That's why it's always the very first thing we do, that we activate and stabilize these detoxification organs and ensure that the excretion works. Because the skin is the last meadow, as they say. So if the other things don't work, it goes over the skin. And then people react by making the skin worse. But what we also see, for example, which is also a topic for some patients, are lipids. Inflammation in the fat subcutaneous tissue. These are in turn caused by what we discuss all the time, environmental influences and so on. There is of course also a genetic tendency to react like that. But if you treat these things, they go away. Sometimes we have patients who have no hair, the hair falls out, not like with me here, androgenically, i.e. through male hormones, but simply diffuse. Then they have huge spots or the hair are all gone. Some come, they have no eyelashes, no eyebrows, no beard, nothing. These are typical autoimmune processes. And so far we have managed to get all the hair back. Interestingly, we also have patients, for example, I had a lady who had no hair in her body for 25 years. And they all came back with over 40, in original color. They were not grey, they were really dark brown and they stayed that way. That's how it has been in recent years.
Yes, there are such stories. I wanted to hear that a little more.
But these are, in turn, environmentally harmful autoimmune-causing diseases.
Yes. So really a field where it is worth looking at and really getting down to business again. Is there anything else from your side that is important for the viewers or from your point of view that you would like to tell?
Yes, if you are in such a situation and you are inexplicably ill, you have to keep fighting. I did that. I kept looking, because I always thought, no, that's not the right therapy for me. And luckily, I came to Dr. Burgard at Wagner-Weier, and for a year my life has normalized step by step again. Great. Because otherwise you are stuck in a dead end where you never get out again. Yes, 7 years. And you may get very serious diseases, cancer, I think of cancer, or other autoimmune diseases. And then you are stuck in a real difficulty.
Yes. Then many thanks in any case for your time. Thank you very much.
Thank you.
We are of course happy that the path of suffering has now come to an end and you can now deal with the beautiful things of life again.
Exactly, that's how it is.
Dear Harald, is there anything else from your side that is important to say, or if you really want to inform yourself as a patient?
Yes. As Ms. Wagner just mentioned at the end, chronic diseases, chronic inflammation in particular can of course have consequences. And that is something that is not on our radar at all. It was already in magazine Bild, in the Focus and so on. A few years ago there were actually articles on the side about what chronic diseases do or what chronic inflammation can trigger. That's what it's about. And it is in fact the case that chronic inflammation, cancer, diabetes, high blood pressure, vessel calcification can trigger. The energy formation of course disturbs, but also the psyche. Because every chronic inflammation in the body also affects the brain. Activates the downward cells in the brain. And we see more and more people suffering from neurological diseases, Alzheimer's, Parkinson's, MS, also in young people. And also hormonal disorders. These are the classic consequences of chronic inflammation. That's why you can only complain if someone has a strange disease that you can't get out of it. To go to someone, to colleagues who have clinical environmental medicine or whatever, who can find chronic inflammation and eliminate the causes. Because that's something that, even if there are no serious diseases yet, can definitely prevent them preventively.
Again, very briefly on this amalgam story. I also had an accident in the circle of friends, swallowed an amalgam plump. Not somehow noticed, obviously. It went up to 50% lung functionability, lung fibrosis, cancer was diagnosed, rheumatism, can no longer walk. Full chaos. And can this person get rid of this whole poisoning process? Because some people come and say, take a little coriander, a little zeolite, then it will go out. But is it even possible? Or do you really have to say, there is a certain stage or a certain degree of poisoning, then I have to resort to these technical filter systems?
So if someone is severely poisoned, as you just described, then he will perhaps, if he is a very good detoxifier, partially discharge, no question. But the question is, how long does it take? And what happens in the meantime? The longer a poison affects a body, the greater the risk of damage. There is the so-called Haber's rule, which states that if I get a poison in high concentration, then I immediately have an effect. If I get the same poison in a smaller amount, I have the same effect, but just temporarily displaced, months, years later. If now a patient comes, who, for example, has such a high mercury poisoning, then I would always plead for to discharge the stuff as quickly as possible so that the damage that then arises is not irreversible. Of course, this also depends a bit on the personal sensitivity. Some people tolerate everything, others tolerate little. We've already talked about that. But in such a case, with such a high load, I would always intervene. I wouldn't wait for that. Because you just don't know what's going to break.
Especially because the diagnosis, rheumatism, lung fibrosis, no one has anything to do with that.
These are heavy, life-threatening things.
But everything was also found as a cause. Again, the psyche. But all the more beautiful that there are doctors like you and brave patients who tell their success stories. We just bring that out into the world and hope that it will reach the dentists who are still processing amalgams today. Thank you very much for being here.
Thank you very much. And many greetings to Luxembourg.
Great. Dear viewers, I hope you were able to take a lot with you. It is always important that there are opportunities and ways to find the causes of diseases and accordingly ways that lead to recovery. Thank you very much for watching. Have a good time and see you soon.